My name is Sean Boccaccini. I'm the co-founder of Project Blue. We are a division within the Better Tomorrow Financial Group, and we want to just cover a little bit of feedback and insight from one of our affiliates, Mike Vigil II. And Mike, I'll actually, instead of doing the intro for you, I'll let you tell us a little bit about yourself, your family, and your agency. Who are you and who do you serve?
Absolutely. So yeah, I'm Mike Vigil II, working for the Vigil Group, currently co-owner with my wife. Business has been around for 10 years, so still a relatively young business. Before that, working in nonprofits, and both those areas were for the service of public schools, both for charter schools in New Mexico and small school districts. On a family basis, like I said, work with my wife.
It always surprises me when, public schools, charter schools, nonprofits, municipalities, they probably need these types of programs more than anyone, but because they fall into that category where it's not a traditional business, they really don't have large accounting firms and consultants like us advocating for them and educating them on what's out there, right? And so it becomes our responsibility, as their service providers, to introduce them, to programs that they could benefit from. And not everybody in your role does that. Thank you for being so open-minded and determined to serve them. It's really cool. We don't see it often enough, in my opinion. And so, yeah, it's cool, man. I'm never going to stop singing your praises, and I kind of use you as an example of the ideal avatar, because for us, it's like, bringing the best practices of Fortune 500 companies, to the smaller companies, because they are entitled to the same types of benefits. So we're here to talk about the Preventative Health Initiative, and from your perspective as an expert, what the experience has been like for you. So Mike, tell me, how did you learn about the Preventative Health Initiative to begin with?
One of our clients that works down south, we're in Albuquerque, New Mexico, middle of the state, down south in Las Cruces. One of our clients shot me an email and said, hey, this guy's here and he's asking me to think about some sort of benefit, and I don't know what he's talking about. Can I send him to you? That gentleman essentially cold called, literally walked in the school and asked, can I talk to your head admin? Which is totally fine. It happens all the time. Copy your people, things of that nature. That's how you do business still in most places. And so I said, sure. And that person ended up being your affiliate with Project Blue. So he made his way up. We scheduled a time here in Albuquerque. He sat down with me and provided that PHI, that Preventive Health Initiative plan. And the thing that came out was free. And I'm a skeptic when I'm an accountant. I know how things work. Things are transactional, and generally free does not exist. So I was very interested. I wanted to see more numbers. I wanted to see how it truly worked.
Why do you think the average person in your position would be skeptical when they hear about something like this?
If it seems too good to be true, it probably is.
Right.
Especially when it comes to your own personal taxes. Most people, either they file with their electronic service, or they go to somebody and they say, here's my papers, do my taxes for me. They can't wrap their mind around what it means to have, certain deductions applied in a way, especially under, the code of the IRS, which I don't know if anyone could possibly read or understand that. But obviously, you found people that would be willing to do that and find ways that you can make benefits work. So I think that's the thing, is just the unknown. That makes things very difficult. So I had at least enough basic understanding once we got into the actual numbers to feel comfortable with it at the end of the day.
So we'll talk a little bit about your client journey is really, in order for you to feel entirely comfortable introducing this to your clients, you said, okay, well, I need to know what the process feels like. And so you decided that you were going to enroll your employees into the Preventative Health Initiative first before you introduce it to any of your clients. Is that correct?
That is correct. Yeah. So we had at the time about 20 employees. So I wanted to start off on a small scale, and to put that in perspective, if we were to take all of our clients and number of students that we serve around New Mexico, we would actually end up being the 6th or 7th largest district in the state. So instead of affecting all those people at once and not really having a true understanding of how it worked and if it worked, I wanted to apply it to my group. So Essentially, we have a staff meeting, on a regular occasion, brought it to staff, had them have a good, decent understanding of it. We're all, accountants here, work with numbers, and everyone sort of bought in. All I wanted to do was get the presentation, again, from your affiliate. Everyone was comfortable with that, and we actually went through with it with the enrollment, and we had a good number of people. Almost everybody was willing to take a shot at this, and we're all on it, and we're all using the app. So yeah, we were the guinea pigs that before we send it out to our clients.
That's a best practice. I suggest everybody do the same. We partner with a lot of agencies, and my first question is always, would you want to participate yourself so that you get a feel for it, so that you can actually endorse it and explain it to people. So, good instincts there. Great job. So you guys enrolled, and then tell me about the way that you deployed it to your database, your clients.
Yeah, sure. So essentially, our clients, there's a lot going on when it comes to public schools in New Mexico. There's a lot of bureaucracy. And so on a regular occasion, we'll send out blasts on a blind carbon copy basis to our clients. Basically, the head administrators, the ones that make the call on the ground level. And usually it's going to say things like, here's some upcoming legislation, watch out for this, form that may be coming out. Things just to give them a heads up, good and bad, obviously. Fortunately, I had an opportunity to make this a good blast out to all of our clients. Gave them some very basic ideas about it, and made sure that I wrote in there that this is a nice benefit. It's for preventive health, and I bolded and italicized the word free. I wanted to, give them an idea that this is not going to cost you a dime. Might actually realize a potential savings in some cases.
Yep. Yeah, it's beautiful. And as far as the enrollment process for you and for your clients who've participated, tell me what that's been like.
So for us, enrollment, like I said, it went through smoothly. Had a majority of our staff enroll and no complaints so far. A couple of people actually getting help for their dogs, things of that nature. That's what's the interesting thing for me, anyone in the household.
Funny how many questions I get about the veterinary care, all of the other benefits that are included in the plan, and people ask more questions about the veterinary care than anything.
That's right, man. The pets are family too. I'm a strong believer in that. So yeah, when it came to the clients, so we did get some feedback as far as the people reading my email, but we did have some people interested. There are some that came back and said, well, what is this? Tell me more about it. And so I said, give me a call. I think it's always best to try to talk over the phone as opposed to email back and forths, especially when it might be something that they might not prioritize. So I gave them a brief intro, those that called me back on the phone, and he said, you know what, if you're truly interested, let's get my affiliate into one of your governing council meetings. So they have governing councils that make a majority of their decisions on the high level and pass on the okay for the head admins to move forward. So that's how I got your affiliate in the door. He's been to a number of meetings to date, and we had our first enrollee start their first payroll today. We do have a number of interested, but it takes some time to, especially on a big decision like this. And I want to reiterate that this is a big decision for these schools. They already have a health package. It's expensive, but it is a required one that they have to do. They have required deductions for their retirement, things of that nature. So they're already doing a lot on their paychecks, essentially. So, that's how the process has gone. And we're hoping just to keep that ball rolling. And I've been working with your affiliate.
I think in terms of, average timelines and whatnot, I think you guys did a great job. And I do believe that it was your endorsement and participation in the plan that, is helping to keep those conversations in momentum. And, we're projecting, 8 to 10,000 potential lives enrolled, if we can continue to move through the ranks of the charter schools and public schools. So it is, imagine the impact that you're making in terms of savings, for each organization. You're looking at $50,000 in net savings for every 100 employees. And when we're talking about thousands of lives, you are making a significant impact, in the school system in New Mexico. So again, thank you for your service. I really appreciate you being so interested in, in bringing it to the table to begin with.
So I do want to touch on those two things. The actual cash savings, even though, 1,000, 2,000 might not seem like a lot, New Mexico's traditionally underfunded their students. There's actually a lawsuit that's been running for the past, I think, 6 or 7 years now, that judge agreed that the students have not been funded correctly. So that the public school system that you went through, that I went through, we weren't served 100% the way we should have been. That's the ruling. And in addition to that, because I had mentioned the package that they have to choose this package of health benefits. It's super expensive. It goes up every year. To have this free benefit where they may be able to do things like get prescriptions or do teletherapy and not have things like co-pays or high prescription costs, and they can, they'll have to pay into their normal benefits for things that it might not cover. But if you can defer some of that to your free benefit, putting money back in a teacher's pocket is huge. So again, something that I fully endorse, especially if I can get them to trust that this is actually something that's not going to cost them at the end of the day.
Yeah, and it is. And I talk about this all the time as well, is that not only the FICA tax reductions, for the employer group, but the telehealth. Why go to the doctor, spend the time and money when you've got your doctor in your pocket? They can set up continuity of care with any of these providers and vendors. And so many benefits to them and everyone in their home. And so it is phenomenal gifts that we give to our employees, which also comes with a cash value life insurance policy, which most people don't have. Permanent life insurance, whole life insurance that grows in cash value, and again, and this is one of the most important factors for our business model is financial education and teaching people how their money actually works and how their benefits actually work. So when you can get no cost telehealth for you and everyone in your home and a life insurance policy that's being funded and grows in cash value every month, it really does become an irresistible offer. And I think that's part of the too good to be true element. It's part of the resistance we would normally get. So what I've found is that traditionally CPAs can either be our best advocate or our worst enemy, and I feel like the reason for that is because many CPAs are not educated or they just have not been introduced to these types of programs or have not taken the initiative to learn. And so I'm so grateful for you for having an open mind in that you wanted to research it and figure it out so that you could determine, whether or not it would be a good fit for your clients. Our plan is structured in a way that it protects you, the employer, the employees, right? And of course, we're managing the compliance, so it's completely above board, right? But there are many CPAs out there that are just automatically resistant to this type of thing.
I think there's two or possibly three reasons. First, I think is fear of change and adding on more work. So they see it as, okay, I can implement this. What do I have to do? I have to do more reporting. I have to do more payments out. I have to do more tracking. That type of thing is that they see it as
labor intensive. They're already pretty busy. They got a lot of work to do as it is. This is another thing they'd have to learn.
Right. And I just think that's it's just kind of like the lazy perspective. And if I was that type, then I definitely would not be truly in my vision in serving the community. That's not service. Just because it costs me a few moments of time meeting with people or setting up deductions, paying contributions, whatever it might be, that's my role. I need to have that role. It's not for me, it's for the people. So I think that's one, just depending on the type of organization you're trying to get into. Two, I think would be is that that's you posed the perfect question. Why don't I know about this? This isn't necessarily brand new. You don't see it on the news. It's not coming out in the AICPA articles. I do read those, even though I have no need to test on them. I do keep up with the news on that perspective. And that, just the idea that you can easily Google something and find the negative as to, okay, I won't do this because, similar to like the employee retention credit, everyone said like, there's no way the government's going to give me, potentially hundreds of thousands of dollars. But in reality, that's what it was there for. And then you have the government saying we, made these big decisions and no one's taking advantage, based on lack of knowledge of it. So a lot of it's fear, laziness, or, simply, not having the basis to even go through with it.
It was interesting with like ERC, for example, those are just disaster relief funds, right? They are the government's response to hardship that we experienced because we were forced to have our businesses shut down. But programs like the Preventative Health Initiative and other tax programs that have been in existence for, decades, people are not familiar with them as well. And the reason when people ask me the question why, it's like, well, the government is not going to use the money they set aside for your employee benefit or for your company's benefit to market the program, right? They're not going to spend the money that you're entitled to educate people. We should have CPAs and experts on our team introducing these, types of plans. And again, so, our CPAs are either our greatest advocates, or our worst enemy. They're absolutely not interested at all or open-minded enough to learn, which again, it's going to take some time, and it's going to take some work. The best way to learn is to do it yourself, and so I'm going to make sure that I share this perspective with everyone is, anybody who's interested in introducing their clients to it ought to participate themselves, because then they know what they have to endorse and what the process is like, because just this one relationship is going to impact thousands of lives, and it's essentially valued with millions of dollars, and we never would have been able to do it without you. So really appreciate that. Thank you. Hey, is there anything else you want to add or cover?
No, that just that again, we just want to keep the ball rolling, and however we can help in getting that word out, just being a testimonial. Like I said, I'm doing it myself, and just knowing that you have that level of comfortability, if you can trust somebody that's already done it. So, if someone else already went on that roller coaster ride and they came off and said they had the time of their life, you're going to be like, all right, I'm going to get on. So yeah. I think, that's the main thing, is the word of mouth, because I got the real nitty-gritty from your affiliates showing me all the IRS code, and I just I was like, I can't read this one, but I'm glad someone did that hard work.
Yeah, I agree. Yeah, thanks, Mike. I really appreciate your time.